Hi guys, welcome back. So on the next few episodes I'm going to talk about the 10 stations of OSCE in adult nursing, and when you watch my previous videos, the one I did on knowing about OSCE, I talked about 2 of the stations being professional value and evidence-based practices, whilst 4 are scenario-based about certain tasks you'd be required to do, and then the other 4 being around assessment, planning, implementation, and evaluation. So today we are going to talk about assessment, everything you need to know about assessment. So I'm going to actually give rationales behind what to do, what you're expected to do, why you are doing them, what kind of questions to ask the patients, what to look out for, and all that. And then the next video or the next episode is going to be a practical video about how the task is supposed to be carried out, the assessment is supposed to be carried out. So I want to do all the talking here, the explanations and everything, so that in the next episode we will stick to the timing of the OSCE and then just do the assessments practical. So the assessment actually is 20 minutes. So you'll be given 20 minutes to carry out an assessment on a patient. Now, the assessment may vary. So you may be asked to do a physiological assessment using the News 2. Now, the News 2 is a chart that is given for you to document and record your vital signs, and then to be able to score it and know if the patient needs escalation or the patient does not need escalation. So I'll explain what News 2 is in another video for you to understand better. So you could be asked to actually carry out an assessment for a patient using the News 2, or you might be asked to do a neurological assessment using the GCS score, or you may be asked to do an assessment using the PHQ-9 or CIT. We'll delve into all that, but today we are actually sticking to doing a physiological assessment using the News 2 chart. So I've put up a News 2 chart there. I'll explain what it means. We will do it in another video altogether anyway, and then I'll also put some things that you need to know in the same video. So come with me. I know the video is going to be lengthy because I'm just going to give more and more explanations as to why we are doing certain things, what you're expected to do, and it's quite easy. When you follow it, you get a hang of it, and then when you watch the video as well, you understand everything. Okay, all right, so let's get into it. So now when we are asked to do an assessment for a patient, what do they mean? What are they expecting? So an assessment means you're expected to do a head-to-toe assessment of a patient physiologically, and they have a mnemonic, or they have an alphabet frame that you're supposed to use. So we've got the A, B, C, D, E, where the A stands for airway, B stands for breathing, C stands for circulation, D stands for disability, and then E stands for exposure. So if typically you have you get to the OSCE setting and then you are asked to do an assessment, what do you look out for? So what you have to be cautious about is, first of all, the paper that you've been given. The question paper, I mean, you have to read it very carefully to know what you are required to do. So there are differences in the papers you'll be given. There are differences in the questions, and they put specific things in the questions to give you a clue about what type of assessment to do, or where you are doing the assessment, or what to do to the assessment, what to do for the patient. So for example, you may be given a question paper that states that your patient is in the surgical unit and was brought on account of shortness of breath, was brought on account of chest pain, etc. So perform an assessment. Now with this, it has given you a clue where the patient is. That is the hospital setting. It has also given you certain clues that the patient has shortness of breath, the patient has chest pain. So that means during the performance of your assessment, there are certain vital signs that should not be within the normal. For example, a patient with shortness of breath might be using the accessory muscles to breathe, or might actually be having tachypnea, breathing fast, trying to compensate for the difficulty in breathing or the shortness of breath. So these things are something that you have to pay attention to, because during the OSCE, if you're identifying that you've got the right patient, the whereabouts of the patient is important. So if it states that the patient is in a ward in a hospital, you know it's a hospital setting. If it says that you are asked to go to the patient's house to go and perform an assessment, you know that it's in the community. Or if you've been asked that you are in a GP setting or a practice, GP practice setting or a doctor setting. These are some of the words that you would see. So a GP practice or the patient's house depicts that the patient is in the community. Whereas when they say the patient is on the ward, is in this unit, is in that unit, it's also telling you that the patient is in the hospital environment. So these cues gives you it buttresses what you need to know, and it helps you to know what to do as well. So for example, in the beginning, if you are asked to do an assessment, what you do is, first of all, you have to check the scene for safety. So you declare and say, oh, I can confirm that my scene is safe, that there is no risk for slip, trip and falls, that the place is fine and it's okay, and you are happy to continue. And then you go on to introduce yourself to the patient. So always remember that you have to check for safety first and then introduce yourself to the patient. So in introducing yourself to the patient, you can start by saying, hello, my name is so and so, and I'm here to perform a physiological assessment on you, which is A to E assessment or a head to toe assessment, and I'm going to be touching you and checking some vital signs for you as well. So you just give a brief explanation of what you are going to do whilst introducing yourself. So you can frame it anyway, but make sure that you talk about what you are going to do, and you may not necessarily say how you're going to do it, because as you're doing the procedure, you're talking. If you waste time on the introduction, because we've got just 20 minutes to do all those things, so you can just briefly, hi, my name is Nurse Mavis and I'm one of the nurses attending to you. So this morning I've been asked to do a physiological assessment on you, which is a head to toe assessment or an A to E assessment on you, and in the course of doing that, I'm going to be touching your arm, or I'm going to be touching maybe your legs or something to check certain things. Then you go ahead to identify the identity of the patient, to identify that you've got the right patient. So the reason why I said we should pay attention as to whether the patient is in the hospital or in the community is because if the patient is in the hospital, we do a three-way check. If the patient is in the hospital, we do a three-way identity check. That is, the patient should be having a wristband, and then the document you're having would have the patient's name and the patient verbalizing their name. So it's a three-way check. So you have access to the wristband. So you tell the patient, can I touch your wristband, please? Yes, that is, after you've washed your hand and sanitized your hands anyway. Can I touch your wristband? And the patient says yes. Okay, so you touch the wristband, checking the name. You're looking on the document you're having as well, and then you can tell the patient, can you confirm your full name for me? So as the patient is doing that, you're checking, can you confirm your date of birth, hospital number as well? So when the patient is at the hospital, we are asking for three things: the name, the full name, the patient's date of birth, and the hospital number. They have all been written on the wristband and on the document. And then you can go ahead and ask the patient if the patient has any allergies. It is a must to ask because we've got allergy wristbands for any patient that has an allergy. So sometimes you'd see the patient has a red band. I don't know what band color of band will be used during the OSCE or at a particular center, but I know mostly it is red. So if the patient has a red wristband, that notifies you that patient has an allergy. But regardless, you still have to ask, because maybe it is part of the test. Patients may have an allergy but does not have a wristband. So just for them to know, if you would remember to ask if the patient has any allergy, and if there is no wristband, you can just escalate. Assessor, my patient has an allergy, however does not have an allergy wristband. The assessor might say noted, continue. So sometimes they just want to know that you know your way around certain things, and you'd be able to identify certain mistakes or certain faults around certain things. So if the patient says, I've got any allergies, you can ask, oh, what are you allergic to? Patient can say, okay, I'm allergic to penicillin. Can you tell me what happens when you take penicillin? Patient can tell you, I have rash and all that. So you note that down, because that is also going to help you in your next stations that you are going to do, maybe the implementation or the planning. It would help you as well. So be noting all these things. Now, we've done the hospital three-way check. So if you were to be in a community, of course, if patient is in their own house, they wouldn't have a wristband on. Or if patient is coming to you in the clinic, they wouldn't have a wristband on. So that's going to be a two-way check. That is the document you are having against the patient's words, like the verbal confirmation the patient is giving to you. So can you tell me your full name? So it's just a two-way. Patient is giving hers, and then you're cross-checking and confirming with the document you have. Can you tell me your date of birth? So here you are not asking for your hospital number because the patient does not know, and the patient does not have the wristband. So sorry, if you're checking for that of the hospital, you can just say to confirm your hospital number is 10, because the patient might not have it off head. So as you're holding the wristband, you can say, so I can confirm that your hospital number is 100 against what you have, and then that of the wristband. But in the community, hospital numbers are not included because you're in the patient's house, or the patient has actually walked from the house to the clinic, or has been brought into the clinic. So there would be no allergy wristband, or there would be no name tag or wristband around the patient. But you still have to ask, do you have any allergies, just so you can note it down as well. So that is the ID check. So after you've done the ID check and confirmed that you've got the right patient, you can now go ahead and ask the patient, so are you happy for me to continue? Is the patient happy for you? The patient might say, no, I don't want you to continue. It is a must for you to ask, because it could be tricky if you don't ask and you assume and just go on. The patient might say, no, I'm not ready, and that's a fail because she did not ask the patient for their consent. So it's consent seeking. So I've spoken about introduction, introducing yourself, checking the safety, introducing yourself, doing an identity check, and then seeking consent. So are you happy for me to continue? Okay, if the patient says I'm happy to continue, then you ask, you capitalize on comfort. Everything you are doing, make sure your patient is comfortable. So are you comfortable in the position you are in? Do you want me to help you in another position? If the patient is sitting, do you want to lie down? If the patient is lying, do you want to sit up? Is there anything I can do to make you feel comfortable, or you're comfortable the way you are? So if the patient says I am comfortable, then that's it. So it means that you've done these 4 things, and then you can go ahead with the other part of the task. So these things I have said literally runs through all the stations. So if you have to do any task, these 4 things come first before you move into the actual task. So moving into the actual task, what we have to do is, after you have said all these things, you can now say, okay, so I am going to prepare my equipment. If you need me or you need anything, kindly press the call bell. And then you show them where the call bell is, or assume you've put it by their site, and then you go to perform your equipment check and everything. So before you perform your equipment check, because you've been in touch with the patient environment, so we are using the 5 moments of hand hygiene: before a procedure, after a procedure, before coming in contact with the patient, after coming in contact with patient environment, and then after touching body fluids or anything. So we've come in contact with the patient's environment, so you perform a full hand wash, and then you have your machine, your vital signs machine, or your OBS is called your observations. So your observation machine or OBS machine. So I have a picture up there of how it should look. I don't know how the centers would have it, but before you go into it, they'll show you the equipment they have and how to put it on. So first of all, what you have to do is, when you see your machine, you have to confirm that it's clean and it has been cleaned. So you just tell the nurse, after checking, you have to tell the assessor, I can confirm that my BP apparatus or my OBS machine has been cleaned. And then you can also check for calibration. So what happens is that at every time or every part of certain years, the machines are checked and calibrated to make sure they are in date and they are working. So they put the date at which it was calibrated, so that I have a picture up there. So you can say, I can confirm that the machine has been cleaned, the equipment is clean and is in date and has been calibrated and is in date. Then you know that, okay, you have checked for all those things. So we don't want an issue where you want to press on the BP and it's not working or something like that. And then you switch the machine, make sure it's working. So the machine should consist of the head and then the one connecting the BP cuff. Make sure you have different sizes of the BP cuff, as you can have a patient that has a bigger arm or a patient that has a smaller arm. So you should check that you have different types of BP cuffs. Also, you should check that you've got an SpO2 machine or a pulse oximeter connected to the BP machine. You should also make sure you've got an infrared thermometer or any thermometer that has been used there as part of the machine. You switch on the thermometer, check the display parts to make sure that there is nothing blocking it, there are no dirt, it's clean and it's visible. Then you say, I can confirm that it is visible, the infrared thermometer is visible, can be seen, and it's in date. And then you check the BP curve, check that the SpO2 machine or the pulse oximeter has a light on that shows that it is working. So after doing all these things, now you can perform a full hand wash and then dab your hands dry. Put the sanitizer, rub it. So you add the sanitizer to your BP equipment, your OPS machine, whilst you're going to the patient bedside. So you actually sanitize your hands and then get close to the patient to the machine. So when you get close, you say hello, like, okay, introduce yourself again, I am back. Are you so happy for me to continue, to make sure the patient has not changed their mind? The patient can say, okay, I am happy to continue. Now, if you're doing all these things, note the environment, look around your table, what was put there. The examiner might put a hearing aid, might put glasses, might put a denture, that's artificial teeth or anything there. They are cues trying to tell you. So if you see a hearing aid, it's trying to tell you that the patient is hard of hearing. So you can go ahead and say, oh, I've seen a hearing aid here. Can you hear me all right? Do you need to put it in? So it's like they want you to be intentional, pay specific attention to certain things. Glasses. Can you see me well? I've seen that you've got glasses here. Are they reading glasses? Do you want to put them on now? So that's, even these things could even help you to come up with care plan. So the patient has hearing difficulty, patient had this, patient has that. So there are certain things. So just be mindful of your environment. Read the question, watch around, know what you're doing. When the patient is talking, slurred speech, all those things. So let's go on now. You're starting. So starting with the airway. So now you ask the patient, can you confirm your full name for me? Patient confirms the name. Can you confirm the date of birth? Patient confirms the date of birth. You okay? Patient says, I'm fine. So if the patient is able to talk in full sentences, that's not slur, there are no gargles, or there's no wheezing sound, it means patient's airway is clear. You could also ask the patient, can you open up your mouth for me, please? And then you check the patient mouth to see if there is anything blocking. That's a conscious patient. If the patient is unconscious, you wouldn't be able to check by the patient talking. You could only do a jaw thrust to check if there is anything dislodged in the patient's mouth, or you could ask if the assessor can confirm if the patient has anything blocking. However, if your conscious patient has anything blocking the airway, you can use the right equipment to remove. You are not doing it there, but you verbalize it, so the assessor knows that you know what you're doing. So you say, oh, my patient has been talking to me in full sentences, has no slurred speech, and it's not gargling, and there is no wheezing, so I can confirm that my patient's airway is clear. However, if my patient's airway was blocked, I would have used the appropriate equipment to remove any blockage from the patient's mouth. You are not doing it, but you're letting the assessor know that this is what you would have done. So now you've checked and confirmed that the airway is open, there is no blockage, and everything is fine. We move to the B. Now the B is breathing. So with the breathing, we are checking if the patient has any respiratory distress, and with respiratory distress, we are looking out for signs like wheezing, whether the patient has seesaw breathing, the patient is breathing with accessory muscles, or the patient is having any difficulty in breathing, snoring, or you can hear any crackles as the patient is breathing. And then we are also checking for the patient, if the patient is cyanosed, the patient looks pale or bluish. Sorry, if the patient is cyanosed, we're checking if the patient looks bluish or purplish. That means the patient is not breathing well, and so oxygen is not getting to the parts of the patient's body. You have to be checking for the patient's capillary refill to check that patient is breathing well and the patient is well perfused. So how would you do it? So you ask the patient, hello, so I just want to check that your blood is flowing to your body very well, and I'll need one of your fingers to check that. I also need to check your oxygen saturation. So which finger would you be happy for me to use? Seek consent in anything you want to do. So the patient might tell you, okay, you can use this finger. I think this is okay. Okay, so you just have to check that the nail bed is fine, that there is no fake or artificial polish, that there are no bruises, there is no pain, there is no rashes or anything. So assessor, I can confirm that the patient does not have any fake nail or artificial nail polish on the hand, and that the hand is clean and has no. Patient confirms there is no pain, because she asked, do you feel any pain? No, there's no pain, and the hand is safe to use. So always remember, before you touch the patient, sanitize your hand. So you tell the patient, okay, so I'm just going to press on your nail bed a bit to check for capillary refill. If it is painful, please tell me and I'll stop immediately. So you're going to press your thumb against the patient's nail bed for 5 seconds, and then leave it, and then start counting for 5 seconds. So you press against it for 5 seconds, leave it. So capillary refill mostly should be less than 5 seconds. So basically you press 1, 2, 3, 4, 5, 1, 2. So I can confirm that patient's capillary refill is less than 5 seconds and it's 2 seconds. Verbalize all this, say it so the assessor can actually hear it. So after you've done that, you sanitize your hand again and say, okay, I'm going to connect this because now you know that capillary refill. So the reason why we are checking the capillary refill is so that when we put the oxygen probe on the patient's hand, we know that enough blood with oxygen is flowing into that particular finger, and we are not going to get the oxygen saturation wrong. So after we have confirmed that that particular hand has good capillary refill, that particular finger has good capillary refill, we can now put the oxygen saturation or the pulse oximeter on to say, okay, so I'm going to connect this on your hand. It is going to check your oxygen saturation. Now whilst I'm going to put this, I need you to be quiet and be still for me for about 2 minutes. Ideally, you're supposed to check oxygen saturation for 1 minute, but we are saying 2 minutes because as you're checking the oxygen saturation, you're expected to check the respiration as well. That's why we are asking that the patient stay still. So you when you say that, the patient will keep calm still, because in the patient's mind they think you are just checking the oxygen saturation. If you make them aware you are checking the respiration, it might alter it a bit, because some of them can get anxious, their breathing might change and all that. So they are not aware. You just tell them you are connecting this and you need them to stay calm for about 2 minutes so you can check the oxygen saturation. Now when you connect that and it is checking, you tell the assessor, verbalize everything to them, let them know what you're doing. So you tell them, okay, I would like to, I've connected the SpO2, but in the course of checking the oxygen saturation, I would want to check the patient's respiration, and I'm going to do that for 60 seconds. And I've been able to see the rise and fall of the patient chest. So make sure you are seeing the rise and fall of the patient chest before you actually start the timing. So I have seen the rise and fall of the patient chest, and my time starts now. So the assessor might also be counting, or in the head is trying to know that you used exactly 60 seconds to check it. So my time starts now, and then there is a time around. So you check for 60 seconds, and when you are done, you say, okay, for respiration was 21, patient was not using accessory muscles, it was deep and shallow, it was okay, there was no reason, there is nothing, and so 21. So you have seen that. And then SpO2 is 98 on room air. If the SpO2 is somewhere 92, you could ask, is that your normal? You can ask the patient, is this your normal SpO2? Because we can have patients that have COPD, asthma, and they are on scale 2. Scale 2 means that they have a particular boundary, or they have a particular range that is acceptable, that is 88 to 92%. So if their breathing is within 88 to 92%, we say it is within the limits of their condition, and we don't have to force it to get to 96, because they have an underlying condition that is preventing their SpO2 to be the same as that of someone that does not have any respiratory disease or anything as an underlying condition. So they may be retainers, they don't need oxygen. So you can ask the patient, is it your normal? If the patient says yes, you don't need to bother. So just be careful. That's why I said you have to read the question to be able to know what the patient has an underlying condition, what to look out for. So after you said that, now there are two ways to do this. Some people can write this down. There is a sheet at the back of the question sheet. Some people can write this down, and when they are done, plot everything on the news 2 chart. Others too, whilst they are doing it, they are plotting. So if you want to do it anyway, either way, you can just tell the patient, can you give me a few minutes? I want to jot this down and I'll be back to continue for you. Is that okay? Patient says that's okay. So you quickly write it down, sanitize your hand again, and say thank you, because you've touched something you're about to tell the patient now, and you say thank you. So that's for breathing. So if you have any comments, if you have anything, make sure you drop it in the comment section and I'm going to address it. In the meantime, like, share, subscribe, and follow this channel for more. Nice having you on the channel. In our next episode, we are going to talk about the part 2 of the A to E. I know it's lengthy, but trust me, you're going to love it. Stay tuned. See you on our next episode. Bye.